I welcome you, Isha. Very good afternoon, everybody. Thank you, ma'am, for the wonderful introduction. My topic for presentation today is body contouring. Before I actually get into body contouring, what do we really mean by plastic surgery? Plastic surgery is really the art of molding or giving shape. It is derived from the Greek word plastos, which meant molding or giving shape. The inception of plastic surgery was somewhere in 1941 when the World War I brought in crippled soldiers with broken noses, fractured mandibles, mangled limbs. That was the era of reconstructive plastic surgery. However, even though over the years reconstructive plastic surgery has undergone a lot of medical advancement, the last few decades have brought around a new field of plastic surgery which focuses on enhancement of the human body, and this is what we call as aesthetic surgery. I'm sure all of us in the audience have been part of a selfie. This selfie craze makes people want to post picture perfect images of themselves to not wanting to miss a single moment of their life and posting it on social media. And this selfie craze is only on the rise. Also, along with the new generation, the Gen Z, which is the age group of 19 to 24, they have access to these filters, these beautifying apps which makes them look absolutely flawless. And this is what they come looking for even in real life. Now the truth behind these apps is that they are backed by 3 mathematical principles which also guide plastic surgery. The first being the OG curve, which is an S-shaped curve which defines the malar prominence. A youthful OG curve defines the malar of the cheekbones and then hollows out into the mid-cheek hollow, which enhances the mid-face as well as makes the eyes look youthful and more prominent. With aging, this flattens out, giving a dull appearance with flattened out eyes. Then there is something called the Fibonacci sequence, wherein which states that everything in nature exists in a proportion of 1:6. This is known as the divine ratio or the divine proportion. Also, in the human body, the ratio of the phalanges is a 1:1:6 ratio. That on the face, between the upper 2/3 and the lower 1/3 of the face, when aesthetically defined, is a ratio of 1:6:1. Similarly, on the body, the navel is placed very strategically between 1:6 of the upper torso and 1, which is the lower torso, between the symphysis pubis and the position of the navel. So keeping these things in mind, also when we see the ratio between the width of the face to the length of the face, it is a ratio of 1:6. The length of the nose to the width of the nose in an aesthetic appearance is also a ratio of 1:6. So this ratio is what all these current beauty standards are very commonly defined by. Now, I do not mean by this that beauty is anywhere defined by any mathematical law. However, a combination of various symmetries, proportions, and a balance between them and harmony between them does help us bring forward an enduring criteria of beauty. Also, the Gen Z today do not think that they need a genetic lottery to look appealing any longer. They do not believe the ones before saying that beauty lies in the eyes of the beholder. For them, beauty lies in the number of the Instagram and Facebook likes that they have. So these procedures are only on a rise in the coming era. Another topic that I want to throw light upon is body dysmorphic disorder. I'm sure all of us would be aware about this. These are individuals who are dealing with body image issues, and there may be women who are unhappy with the size and shape of their breast, men with a pot belly who want to have a muscular appearance, and these kind of individuals, if helped by the right kind of advice, can be returned back to society as much more confident individuals with better self-esteem. So with that, coming to my topic today, what do we understand by body contouring? Body contouring is a series of surgical procedures which help to reshape and restore and improve the overall appearance of the body. In today's day and age, everybody wants to look good. The body image is very important in the psyche of people of both genres. It is closely linked to their self-confidence, their feel of success, for them getting better job placements, faster promotions and remunerations, and being able to find a better match, and is also associated with youth, vitality, good physical and reproductive health. Now men come looking for a very powerful, muscular, athletic kind of appearance, whereas women want a more healthy, toned body with desirable curvatures. Coming to problems that women face, different aged women have different kind of cosmetic problems. A young differs from that of post-pregnancy ladies, whereas that differs from perimenopausal women. Young women are dealing with issues like PCOS, acne, excess weight and unwanted fat in certain body areas, unhappy with their breast shape and size. As compared to which post-pregnancy women are dealing with laxity of the anterior abdominal wall, sagging of the breast, post-pregnancy melasmas and hyperpigmentations with divarication of the recti, alopecia, stress urinary incontinence and dissatisfaction with their intimate parts. Compared to which perimenopausal women come with an aging face, alopecia again, laxity of the arms, of the abdominal wall, of the breast, and some vaginal dryness and stress urinary incontinence. So in today's day and date, total makeover that is addressing every single problem that the patient has in its own way is the new concept, which involves problems of the body, the breast, face, skin, hair and the intimate parts along with anti-aging treatments. My talk today focuses only on treatments of the body and the breast. The face, skin and hair requires a whole different lecture, so I will not be getting into that. Now coming to body shaping, the common problems that we are encountered with are either generalized obesity or areas of localized fat, that is, a patient would be unhappy with fat in a particular body part, loose skin after massive weight loss, muscle laxity or chronic body aches, where patients come with knee pain, shoulder pain, back aches, etc. So when such a patient comes to us, the first step forward is assessment of the problem, wherein we do a body fat analysis followed by calculation of the BMI. Now a BMI less than 31 makes the patient amenable to body contouring surgery. However, if more than that, the patient is better addressed with a bariatric surgery, and after adequate weight loss, the skin laxity could be tackled with contouring procedures. Other problems need to be investigated, such as diabetes, hypertension, familial traits of obesity, PCOS, other endocrine problems, and adequate medical management or lifestyle modification for them is done. Post which the local examination for the muscle mass, the laxity of the muscle and the ratio of the visceral to the subcutaneous fat helps in deciding what would be the ideal procedure for these patients. In spite of adequate diet and physical exercise, some areas of resistant fat may still not go. These patients can be helped with liposuction. Now if we see in these images, the patient is actually a lean waisted patient, however has excess fat in the regions of her hip. So this can be contoured and with liposuction, and the patient given a much contoured body. Now liposuction is the procedure wherein excess fat deposits which are located between the skin and the muscle layer are removed by small punctures which are made on the skin. Cannulas are inserted via these punctures and moved in a to and fro direction in order to cut off the fat molecules with the help of the suctioning force on the cannula. This is then suctioned out and the process is repeated multiple times till the adequate desired contour is achieved. The advantage of this procedure is that the keyholes do not leave any significant visible scarring and faster recovery. So the procedure is, the patient is first, the desired area is adequately marked, the body is prepared and scrubbed with antimicrobial solution, the patient is anesthetized, post which puncture wounds are made on the skin for insertion of the cannulas. First, a tumescent fluid is infiltrated and after that, fat is liquefied and suctioned out with the help of a suction machine. Common areas that can be addressed with liposuction are the abdomen, breast, thighs, neck, double chins, the male breast, especially gynecomastia, and arms and legs. 8 to 10% of the total body fat can be suctioned out safely at one sitting. However, in cases where more than 6 liters of fat is required to be suctioned out, these procedures are called as mega liposuctions and require good monitoring of the patient in the post-operative period. Aftercare requires these people to wear compression garments for at least 6 weeks duration after surgery. Summarizing this, the anesthesia required could be a local or general depending on the body part that we are addressing. It takes about 1 to 3 hours for the surgery with a hospital stay of 1 to 2 days. Post-procedure, the patient has some increase in the swelling for the next 2 to 3 weeks, post which it reduces. So the patient sees the final result after a period of 2 to 6 weeks, and recovery with respect to pain takes about 3 to 10 days to settle. So about a week to 10 days later, the patient can resume their daily life and work. This is the result of the same patient which we saw earlier, the front and the back images, and a well-contoured lower abdomen and the hip area. A male patient with a grade 3 gynecomastia which was addressed with liposuction along with the excision of the gland. Now, what's new with liposuction? There are patients who come for abdominal etching, that is, they want a six-pack creation. This is done with very fine, small bore, 0.8mm cannulas to enhance and augment the actual muscular curvatures of the anterior abdominal wall. The latest technique in liposuction is laser liposuction, which is vibration amplification of sound energy with resonance. In this, an ultrasound technology is used in order to break the bonds between the fat cells so as to remove them easily and more precisely. This allows us to do lesser mechanical liposuction, so also causing lesser surgeon discomfort, lesser bruising to the patient, decreased pain, a shorter downtime, and the advantage of applying this ultrasound energy to the skin is that it allows skin tightening, more precise liposculpting, and prevents damage to the surrounding nerves and tissues. Also, there is Embrace radiofrequency technology, which uses a combination of radiofrequency and bipolar energy. It has 2 probes, one that is applied from the outside of the skin surface along with a needle that pierces into the fat and applies radiofrequency energy to the fat molecules. This allows even better skin tightening and improves the appearance of sensitive areas, especially on the face, such as the chin, the neck, the jowls, etc. Coming to tummy tuck or abdominoplasty. In patients who are post-pregnancy having had massive weight loss, where there is muscle laxity and excess of lax skin, liposuction is not enough. We need to get rid of the excess muscle, excess skin, as well as tighten the muscle. For these patients, abdominoplasty is the way forward. The lower excess skin in the abdomen is excised via transverse incision, which is kept in the bikini line of the patient so that it can be hidden post-operatively. A flap is raised right up to the zippy sternum and the muscles are tightened. A new hole, a youthful new hole is created, like I said again, at the ratio of the 1:6 between the zippy sternum to the mons pubis. This is the image of a post-bariatric weight loss patient. Coming to arm skin laxity, there are a lot of patients who are suffering with laxity of the arm skin. Now there are 2 procedures to address this, one being liposuction, the second being brachyplasty. In liposuction, where there is no excess laxity of the skin, only contouring of the extra fat can be done with the help of liposuction. However, For excess skin, brachyplasty needs to be done, either a standard or a mini incision brachyplasty, wherein the final scar line is hidden within the medial seam of the arm or in the axillary crease. Coming to breast problems, common breast problems that women face are either a small breast or a large breast, that is also known as gigantomastia, or sagging breasts. Small breasts could be since puberty or post-pregnancy, and the options that we have for these are breast implant and fat injection. Now, augmentation between by silicone implants or fat is a constant debate. However, the patient needs to be examined, what are their requirements need to be assessed, and how soon do they want their results is what needs to be assessed in order to decide what would be the better modality of treatment for them. This is a 26-year-old lean and thin patient who did not have much of a fat reservoir that could be taken out by liposuction. So she was helped with an 300cc silicone textured high profile implant, which was placed via the intramammary approach, and as you can see in the image, the scar is fairly acceptable. This patient, since she did not have much of a fat reserve and wanted results very soon, was given a silicone implant. However, if there are patients who have at least 1 to 3 months of time, do not want any scarring at all, and have some fat that can be taken, then fat is harvested from regions like the abdomen or the thigh and is then injected into the breast. In this patient, about 250 to 300 cc was injected in each breast. And the images that we saw are actually a 3-month follow-up. Then coming to large, heavy and sagging breasts, either due to genetics, pregnancy or weight gain, patients may have large, heavy and sagging breasts, which could lead to embarrassment, discomfort, shoulder pain, backache, and some fungal infection with hyperpigmentation and maceration in the intramammary crease. These patients suffer from a lower self-esteem and are dissatisfied as they are unable to wear clothes of their choice. Such patients can be helped with breast reduction surgery, which is a procedure to lift up the breast and modify the size as well as the contour of the breast. This is again an image of a patient who underwent breast reduction surgery and her 1-month follow-up. The patient is very happy with her result and now wants to go ahead with a further abdominoplasty to set the abdomen contour right. Coming to my last topic, which is sagging breasts. Now, just when there is a drooping of the breast mound with age, due to the effect of the gravity on the breast tissue, the breast can be lifted up, the nipple is moved up and the skin is tightened and a vertical suture line is given. This can also be combined with reduction via a surgical reduction or a liposuction. Again, another patient who underwent mastopexy with a vertical scar and her 1-month follow-up. Scars take time to fade. This is at 1 month where there is still some reddish pigmentation around the scar. However, by the time 3 to 6 months and the scar gets some time to mature, and with scar massage therapies, the scars look much better and are very much aesthetically acceptable to the patient. With this, I come to the end of my topic. Learning is always an ongoing process and always happy to learn whatever that we can. Thank you so much.
Thank you, Isha, for a wonderful talk. We as a pediatrician, we keep on measuring so many things. We take height and weight and upper arm circumference, upper segment, lower segment, span and whatnot. And today we came to know about so many other measurement needs to be taken, and which is totally ignored in the medical colleges. It's a totally new field, that's what I feel. We must do it, and again we have to teach it to the students. That's a really wonderful talk, so many new things have come. So with this, we really thank you, and we invite Dr. Paresh Munshi and Dr. Yes, any question if anybody else?
We learned so many things from you first time. One is a beauty question and one is medical question. They go for Miss Universe and like that. What you said 1 to 6 and 6 to 1 and all that, I don't remember. But a lady go for the beauty contest do that expert consider that your ratio, what you told us?
Sir, actually there is a research paper on this and I'll be happy to share it with you wherein they mentioned that from 2001 to 15, they actually studied the faces of all the women who had won the beauty pageants and their ratios did very much fall in the described golden ratio. I'll share that paper with you, sir.
Thank you. And second, does silicone implant have any complication, later or any complication?
Sir, silicone implants are a little more prone to capsular contracture, which is one thing. Apart from that, there are studies which show, however, the incidence is only 1 to 3%. However, there are studies that show that silicone implants are somewhere associated with breast cancer, the ALCL cancer, not the breast cancer.
Thank you.
So father and father-in-law must be feeling so much proud about Naresh Bhai and Rajiv Bhai. She has delivered a wonderful talk. And with this I invite...
One more. Please, all the time.
If a person is with PCOS or like hypothyroid or something, they again gain weight very fast. So what about those people? Do they have to go through repeated procedures?
Ma'am, post